A health crisis has engulfed Britain, leaving thousands dead and millions infected. The coronavirus lockdowns have created yet another crisis, however, a crisis in our mental health.
I think all the referrals that we've had recently during the pandemic have definitely been pandemic related. Because the pandemic has affected our anxieties, it's affected our finances, it's affected our general abilities to socialise with our family, with our friends, and our general kind of coping mechanisms. You know, people used to be able to go to the gym to de-stress. People used to be able to go to a friend's house or go to a restaurant or a takeaway. Now they're not actually able to do that, and people are indoors, potentially in abusive situations or potentially in challenging situations. Even some of our clients, you know, they used to come here at least once a week and have a group setting and kind of switch off for a little while and be away from the atmosphere. Now we don't really have that.
As the pandemic rages on, referrals to mental health services have skyrocketed. And according to the Office of National Statistics, male suicides are at their highest since the year 2000. One group of Britons that are often neglected in statistics around mental health are Muslims.
A report in 2018 found that 32% of young Muslims had suffered from suicidal thoughts at some point, 52% had suffered from depression, and 63% had struggled with anxiety. And the report overall found that half of young British Muslims had suffered from poor mental health in the past year.
In this programme, we're going to give you a direct look into the issue of mental health in the Muslim community and see what help is out there for Muslims in distress.
Research on Muslims around mental health is very limited. And I speak about this research paper that we did in 2018. Even before then, there was very limited data around it. And even after that, you know, we are still struggling, which is very difficult, which is very sad because it tells you that, you know, this is a space in academia that is very scarce.
While data on this issue is lacking, more and more researchers are emerging to study the problem. One such researcher is Karim Mita of the University of Edinburgh and the University of Glasgow.
The data is really sparse. So we know that when we talk about the general population, we know that 1 in 6 people from the ages of 16 to 64 will experience a mental health condition. When we look at prevalence rates of depression, that's between 10 to 20% of the population will experience a depressive episode. And when we look at anxiety, we can see that's generally 6 to 9% of the general population. So we know that within the general population, these are the rates. It's natural that if these are the rates within the general population, you'll see similar rates within the Muslim population. The issue is twofold. One is that the issues of Muslim population and mental health is seen as a niche issue. So that means that there isn't necessarily the funding or research drive to investigate what's really a small proportion of the population. So in Scotland, it's 1.5% of the population. In the general UK population, it's 5%. So you can see that, you know, because of the smaller proportion, there isn't necessarily the incentive for it to be seen as a general, broader public health issue.
Despite the lack of concrete data, we know for certain that poor mental health can affect Muslims just like everyone else. We spoke with Timur Khan, who was diagnosed with depression and anxiety. He wanted to share his experience to help break the stigma surrounding mental health.
How it first came across to me was I just felt myself becoming very withdrawn. I found myself sitting with friends and just not interacting. Like I'd have my headphones on, I'd have my head down, I'd be on my telephone. And I'd always have things like, I'm just always really tired. And I think that was something I found out after doing my research is, you know, when you have something developing within you with regards to mental health, you'll always say to people, I'm fine, I'm just tired. And then it got to a point where I just thought, I think I need to see a doctor. So I did. I made an appointment with a doctor and, just normal appointment. I just wanted to have a conversation with them. And I think it was when I was sitting there and I just felt really anxious while I was in the doctor's surgery. And when I went in and I spoke to him and I told him what was going on, I think the first minute was when he checked my blood pressure and my heart rate, it was quite high. And I remember he asked me, he goes, did you run here? Were you in a rush to get here? I was like, no, I took my time. Like I drove my car down, I came here. And when he told me about my heart rate being so elevated and he asked me how I was feeling and he mentioned the words anxiety and depression, That's when I realized it made sense.
The stigma surrounding mental health makes it difficult for people like Timur to come forward with their stories. The stigma is not just prevalent in the broader UK population, but it's also common in the British Muslim community too.
Domestic violence happens in our community. We don't talk about it. Sexual abuse happens. We don't talk about it. We have issues with people for experiencing disordered eating, with addictions, gambling, etc. We don't talk about it. And I think this not talking about a culture essentially can impact people's sense of self-worth, their self-esteem, and their own well-being. On the one hand, if you talk about stigma, we have this almost generational divide of where older people are just pretend it doesn't exist and see it as maybe a gendered thing. Young people want to talk about it, but we don't necessarily have always the tools or the experts within our community to be able to respond to it in a specific way. Social stigma of what if I were to tell someone that you had a mental health condition, what will they think of me, for example? That's a huge thing within our community. And we know that, again, work in stigma and Muslim mental health has come from America. So Chifti and colleagues have looked at stigma amongst American Muslims and found that it's particularly high. But yet, if you do engagement work, if you work with the imams of the local masajid, you can start to break down barriers, you can start to break down stereotypes. And I find it particularly problematic when I hear uncles within the community that say that mental health is a fad, that everybody has depression nowadays. And yes, perhaps it's because we're talking about it more that we are able to normalize an experience that people can go through. But at the same time, what about on the severe end, so severe psychosis, schizophrenia, etc., so severe mental health conditions, drug addictions? We don't want to talk about those, but those issues do occur within our community.
It was a personal perception rather than personal experience. So my personal perception was, I go home and tell my family that I'm suffering with this. They're going to tell me that it's all in my head. I'm going to be told, you don't need therapy, you don't need this, you don't need that, you don't need the medication, you don't need anything, you're fine. And I was pleasantly surprised. Like, I came home and I just remember just feeling very exhausted. I had this label that now was an identity, like, the doctor said, this is what you have, like, this is who you are now. And I was like, okay. Normally when I come home, like, I'll come into the house, I'll greet my family who'll be sitting downstairs, and I'll sit down with them, and then I'm like, right, I'm going to go upstairs and get changed. And I remember the day it happened, I just walked straight upstairs to my bedroom. Didn't even bother turning a light on in my room, just sat there in the darkness, and I just broke down. And, my family's great. They just knew instinctively that something was wrong because I'd broken pattern, I'd broken behavioural patterns. And I remember my mum coming and sitting on the bed with me, my sister coming and sitting on the bed with me, and I told them. What was going on, I told them how it affected me at work, I told them how it was affecting me in life, and I told them I'd gone to see the doctor, and the doctor had, diagnosed me with anxiety and depression. And I could see on their faces they weren't expecting it. But when they heard that that's what was going on, like, my sister was very forthcoming. She was like, try this, go to the therapy, do this. My mum, give her props, she learned more about mental health through me going through it than I feel that any parent would have done. Because, she saw me sitting down on the sofa on a daily basis, just drained of colour. I didn't talk, I didn't, eat very much. I was just constantly stuck in my head until therapy started. So I never faced any, backlash or stigma personally. I think I was really blessed. I've seen that, but I did hear about it from other people. And I've spoken to people recently who have started therapy but having to do it away from their family because of the same stigma that I thought I was going to face, and I was blessed enough not to face it. But there are people that go through it like that, and as long as you get the therapy, it's okay not to tell people, but there is going to be a point where you're going to have to tell somebody.
It's assuring to hear that Timur has such a supportive family who is willing to help him in his struggles with depression and anxiety. However, stigma still does exist. One stigma Muslims face is the notion that poor mental health means you're disconnected from Islam.
When you put that on someone that has already got mental health issues, that is a lot of pressure, a lot of burden for someone to take, which is 100% not right. You can read your namaz 5 times a day, you can do zikr, you can do everything, but you might still have mental health issues. There's nothing wrong with seeking help. And I think that's the important message that we need to give out to the Muslim community, is that there's nothing wrong with seeking help.
Ghazal Amir's work in religious-based behavioral activation therapy has sort of looked at how do we integrate mainstream mental health services with sort of a religio-cultural paradigm. And there's a hadith which she uses, which I think is really useful. So it's a hadith narrated by Al-Tirmidhi, who says that the Prophet ﷺ was speaking to a Bedouin. And he saw that the Bedouin was leaving his camels all about. And the Prophet said to the Bedouin, he said, well, why aren't you tying your camels? And the Bedouin says, well, it's up to Allah's will. Whatever the camels will do, they'll just go wherever they want to go. And then to the Bedouin saying, well, I put my trust in Allah. And the Prophet said, well, why don't you tie your camel first and then also put your trust in Allah? And I think the gist of this hadith is that essentially that, yes, it's fine to put our faith in Allah because anything that we wish for, inshallah, He will make it happen. But also we also need to be putting the effort in ourselves. So sometimes we need to be doing the groundwork. We can't just say, just have sabr and it will go away. Sometimes we need to put in the work. If we go to the GP, we're willing to take our diabetes medication. So why aren't we willing to take medication for antidepressants or anxiolytics, for example?
I've got nothing but endless props for my mom, my sister. I think they were just so supportive and forthcoming, and they've done everything they can, especially with everything that happened last year of no work and being at home. Like they kept my head above water. There was 1 or 2 days where I dipped, but they were really, really good. Like they made sure that I was, doing things to kind of keep my head above that water. So it's positive to have like a support structure around you, but you do have to create that support structure yourself as well. You do have to educate family, because you're always going to be learning about mental health yourself. So, the more you learn, you pass that information on to family and they can learn with you. And it's fantastic. It's such a warming feeling when you have that. I tried everything. Obviously, like I said, I tried therapy. I tried the medication. I did the exercises. I did the breathing exercises. Everything that I could try and do, I did. But for me personally, I found just little things like reading a book. It kind of pulls me out of it. I stick my headphones on. I'll listen to a podcast. I train at home 5 days a week. So I've got weights in the back of the house, which I use on a regular basis. That's 45 minutes to an hour of just, a clear mind and just focusing on a routine task. But that's just for me, different strokes work for different folks. It shouldn't be that just because I do something that helps me, it doesn't mean it's going to be the same thing that's going to help you or 13 other people that are going through this themselves.
In England, if you look at recovery rates of people by different religious groups, people of Muslim backgrounds have the poorest recovery rates in improving access to psychological therapies. So this suggests that perhaps mainstream services aren't really speaking to the particular religious cultural needs for the population. The challenge is that data isn't really routinely collected by religion. It's collected by ethnicity, and even then, the data quality is quite poor. So some of my colleagues in Edinburgh have shown that people of Pakistani backgrounds, so I recognize that you can't really equate the two, but oftentimes we use ethnicity as a proxy. So people from Pakistani backgrounds tend to present at greater stages of their condition and much, much later. So this means that there are structural barriers taking place. They're not accessing services at an earlier stage when you could have intervention taking place. And also when they are being seen, it's at much greater stages, which require them to be put as an inpatient. And there's also data from England which shows that if you look at the rates of common mental disorders, so what we call anxiety and depression, that tends to be almost 2 or 3 times higher amongst Pakistani women than white British women. But yet when we look at the rates of people who actually access care, we see that it's white British women have twice the rates of uptake than Pakistani women. So that's interesting. That shows that there's a gap there in services.
It has been suggested by some that therapists should use a more tailored approach when treating Muslims, one that incorporates both religion and culture.
That's a bit difficult just because I don't think we can use a blanket response for everybody in the Muslim community. Some people may have a very deep understanding of mental health, and they may not be as close to their religion or their culture and may instead like more of a secular response. Some people may need a more individualized plan based on their understanding of Islam or their cultural or other factors that can influence them as well. So a holistic approach and a person-centered approach, I think, is always the best way to approach these. But I think definitely mental health practitioners should take into account lots of different cultures and lots of different religions and the impact that they can have on individuals. So for example, a lot of Muslims come to us and they have that question of, is it jinn or is it my mental health? And I think this is something that we're all quite familiar with. And sometimes they'll go to an imam and they'll tell them, no, like you need to be closer to your religion. And this deep sense of guilt exists amongst a lot of our service users about am I feeling this way because I'm not a good Muslim? Am I feeling this way because I'm disobeying God? Am I feeling this way because I'm disobeying my parents? And so I think it's quite important for mental health practitioners to understand that and understand the deep influence religion and culture can have on a person, and also tailor plans so that they can include both a religious or a cultural perspective as well as our Western understanding of what medicine is.
According to the 2011 census, over 50% of Muslims come from a Pakistani or Bangladeshi background, and almost 1 in 3 Muslims are from the wider BME community. Statistics show British Muslims are ethnically diverse. However, discourse surrounding mental health in the Muslim community can sometimes be centered around South Asian Muslims.
I think it's unfair to generalise that all Muslims are South Asian, because obviously it's not the case. You know, we've got Muslims that are from many different backgrounds, many different cultures, under the one nationality of being Muslim. And I think it's really important that that's recognised within services, because if not, then you're at risk of excluding or isolating people from other communities. And I think that it's a real risk for people with mental health issues. Even if the services are there for the Muslim community, we need to make sure that they're for all communities within the Muslim faith.
There is cause to be hopeful. More and more organizations are stepping up to meet the needs of Muslims suffering with mental health problems. Organizations such as the Muslim Youth Helpline and Sharing Voices are just some services that provide essential support to British Muslims.
We are a helpline that provides emotional support to Muslims in the UK. And we were founded in 2001, and we were founded by young people, so 3 young 18-year-olds who clearly felt the need and the gap that existed in mental health charities.
So we provide a listening service which employs things such as active listening and de-escalation, and we work with a number of different issues that come to us. So they range from people just needing somebody to speak with on a daily basis, or it could also range to somebody who is experiencing thoughts of suicide and need to have that situation de-escalated. So we help with a range of issues, really. They're not always necessarily focused around mental health, but if they are, our helpline officers are also equipped to take a first step to help those people in that distressing situation, but also knowing when to signpost and how to get people in contact with trained counselors who can help them.
First of all, we do direct one-to-one support. So we will, when we get the referral through, we sit down with that person, find out what it is that's going on with them, find out what it is that's making them feel the way that they are, and then what we can do together to make it better for them. So we have that aspect. Then we also have group work where people can mix with and be around people that have been through similar experiences to themselves. So we have women's groups, we have men's groups, and we have young people's groups, and it's all around people making friends with one another, realising that they're not alone and realising that things can get better. Another part of what we do, it's more about taking the voices of the people that we work with, to the policymakers, to the leaders, to the NHS, and saying, this is actually a problem, this is what we find is happening, and this is what we could do together to make it better for the communities that we work with. Or we can be a little bit more flexible. We can look at more creative ways to help someone, and it doesn't have to be the traditional, let's sit down and talk. We can have things like cooking groups, we have walking groups, running groups, all of these different ways of kind of engaging, because sometimes people don't want to talk specifically about what's going on. They'd rather do something about it, or they'd rather find ways of actually coping. And so that's why or how we're able to be a little bit more different. It's important for people to be able to relate to other people. So, for example, when someone sees me, they'll see someone that looks potentially like them, that speaks like them, and with that, they can understand them. To have somewhere or someone that you can go to independently, so outside of your family or social circle, and talk about what you're feeling, and then also get practical help for some of that, I think it's really, really important, and it's really, really helpful. I don't think sometimes people realise the impact that it can have.
Organizations like the ones highlighted here show us that help is out there and that there is a place for Muslims to turn to if they need help. For any Muslims watching this right now who are suffering with their mental health, this is our message to you.
It's important that you talk to someone. It's important to seek help. Anybody that you feel comfortable with, whether it's a family member, a friend, or a therapist, it's important to reach out. Don't go through it alone. There is support out there if you need it.
We do have resources and systems in place to seek help, and that you aren't alone, that you can choose from, whether you speak to the Imam, the Muslim Youth Helpline, or your GP, or even just your best mate. And I think that recognizing that the first step is often just to say, I need help, and that's okay.
It's nothing strange. It's nothing different. You're not alone. I know you hear the phrase being passed around. It's okay not to be okay, and I 100% believe that. I feel that with everything that you're going through, there's nothing bad about you. Don't feel that you're less than just because you have been diagnosed or you feel that you have like a mental health issue. You are still a human being. Your personality is still there. Don't feel that you can't do anything that you could have done prior to feeling like this. You're still the same person. You've still got every strength in you. You've got a slight weakness now, but it's not going to prevent you from being the person you are. So never give up on who you are, and never give up on the fact that you can still accomplish everything, but ask for help. I think those would be the two biggest things. It's okay not to be okay, but definitely ask for help. It's not fun trying to navigate this on your own. Take it from me, I've tried it. It took a long time for me to seek help, but once I got it, everything became clearer. It makes it a lot easier when you've got a crutch and when you've got the support of friends, family, and even the local community.
I think in the past year, I felt it the most, that we are talking a lot more about mental health. And I think what we've all been through in the past year is putting our own well-being first, putting the well-being of others first. All these lockdowns and all these restrictions, we're told to, stay at home because it's important to keep everyone safe. And that's so important to remember that, moving forward, everything that we do is to protect ourselves primarily, but also our community members. Make sure that everyone around you is safe and healthy. Make sure that people are doing okay. Reach out to your loved ones. It's so important that we carry this forward for a better and brighter future.